as you may have heard, we are going to record the conversation, so we'll share that as follow-up. So I'm going to go ahead and get us started here. I'm going to first give a very brief overview on childcare in Texas and some of the challenges and opportunities that we have this coming session, and then turn it over to our great panel of experts from Florida, Alabama, and North Dakota. There will be an opportunity for questions from you in the audience. Please use the Q&A feature at any point during the conversation, and those will go to the panel and we'll be able to answer your questions. And then I'll have a very brief closing. Um, so if you're here today, you probably already know why this issue is important, but I think it's always helpful to ground us in it that expanding access to high quality childcare is really vital for Texas families and the Texas economy. And whenever childcare comes up, you'll often uh, get into these conversations of, well, is it important for early learning reasons? Is it important for workforce reasons? Is it really for parents or more of the economy at large? And the answer is yes to all of those things. It really is important for children's ability to succeed in school, as our school readiness dashboard outlines. It is really vital for working parents to have the ability to go to work, to get the jobs they want, to put food on the table, and know that their children are safe and learning. And it is really vital for businesses in all sectors of the economy. And it really helps those businesses recruit and retain the quality workforce that they need. One of my favorite things I've gotten to do in this job was I was able to talk with a number of parents who have benefited from our state's child care services program. This is a program that we currently only use federal funding to support, but that enables us to provide scholarships for low-income working parents to access child care that is high quality at a reduced cost or even for free. And one of the parents I spoke to is here, Annalise, she shared with me how before she got access to a scholarship, she and her partner were in a really difficult situation financially. Essentially, her entire salary was going to pay for the cost of her childcare, so she was not able to work full time. But then she was able to get off the wait list, able to get a scholarship. And she just talked about how that was such a clear pivot point in their lives where now she's working full time. She's actually decided to start working in childcare, where she is supporting other parents' children. And her child is thriving in a really, really great program. And so this is the opportunities we want more families to have this session. And what many of the states we've had here have been able to do for their states. So some of the challenges we face, a term you've all heard is the child care crisis. It is something that is certainly resonating with folks. And if you're trying to understand why there is a crisis, this first bullet is really what you need, I think, to walk away with that. Childcare programs themselves are operating on really barely sustainable margins, typically less than 1% of profit. You can imagine how difficult it is to run a business with that kind of uncertainty. Texas childcare educators themselves are paid about $12 per hour with little to no benefits. And so it is really difficult for those programs to recruit and retain the staff that make this work possible. And parents, as I'm sure all of you know, are paying well more than they can afford, with infant care costing more than a year's tuition at UT Austin. And so parents can't pay more, the educators can't make less, and the programs are really struggling to make it. Um, Another challenge here in Texas is that the average wait list for that child care services program that Annalise benefited from is around 78,000 children on average in fiscal year 24. And what that means is that if you're an eligible family, you're working, you meet the income requirements, and you show up, often you're told you have to be on a waiting list for 6 months to 2 years. And if you have a little baby, 2 years for care is not going to cut it. And so that's a real challenge in ensuring that the families we serve have those opportunities. We're serving about 150,000 Texas kids today, but we have 78,000 on that wait list. Primarily due to that inability to recruit and retain staff, only 68%, or childcare programs are operating at only about 68% of their desired capacity. And what that looks like is you'll go to a high quality childcare program, you'll see one classroom bustling with activity, an amazing educator supporting her children next to an empty classroom. Not because there's not demand, because they're taking calls from parents who are in tears trying to find care for their children, but because there's just not the staff. And so they're having to turn away parents until they can get enough staff in place. So that 68% is how that is kind of manifesting. As I mentioned, it affects our entire Texas economy. According to the U.S. Chamber Foundation, there's an estimated loss of about $9.4 billion per year for the Texas economy due to this issue. And as I mentioned, this is driven by, in part, that the state is not committing state dollars to help address these challenges. Fortunately, we have sources of inspiration. There are states around the country, from Republican-led states to Democratic-led states, to those who are mixed, who are taking really innovative approaches to this. Back in March, I believe, we wrote a policy brief around how Republican-led states in particular have addressed this. We highlighted many states in there who are taking innovative approaches, investing state dollars. We have three of them here today. Including Florida, which in 2023 supported $100 million in their scholarship program, which they call school readiness, as well as $200 million in the following session to increase reimbursement rates to providers. We have a representation from Alabama, which has a population about 1/6 the size of Texas, which I think is important because their budget is also much smaller than Texas as a result, invest an additional $30 million in state funding for a total allocation of $47.8 million to support the financial stability of high-quality childcare programs. And North Dakota, which has around 2.1 million fewer children than Texas, provide nearly $66 million in state funding to support childcare, including $22 million to support more families in those scholarship programs. So we have sources of inspiration. We have folks who are confronting these challenges, and I'm so excited to bring them to you today. So let me introduce our fine panel here. First, we have Michaela Buchanan, who is from the Florida Chamber Foundation. She's the Director of Early Learning and Literacy, and they are focused on what they call future-focused research, which I love and will probably steal, and uniting the business community for good. And in her role, Michaela leads Florida's Business Alliance for Early Learning project, working with business, philanthropic, and education experts so that all of Florida's children enter kindergarten ready to learn and read on grade level. Michaela, thank you so much for joining us. Next, we have Jessica Thomason, who serves as the Executive Director. Oops, I should change the slide. The Executive Director for North Dakota's Human Services Division, and where she provides oversight and direction for a wide range of economic, health, and family well-being services within that department. Jessica's department manages the state's child protective services, child care strategies, and access to a range of resources designed to help families who are struggling to meet ends meet. Thank you, Jessica, for being here. And last but certainly not least, we have Faye Nelson, who serves as the Deputy Commissioner for Family Resources for the Alabama Department of Human Resources. And that involves managing the Child Care Services Program, the TANF program, Food Assistance Program, and the Child Support Program for the state of Alabama. I'll also mention that she began her career with the department in 1979 as a social worker within the Dallas County, different Dallas County, but Dallas County Department of Human Resources. Faye, thank you again for being here.
Thank you.
All right, so I'm going to stop sharing slides so we can more perfectly see our great panel here and begin asking questions. And if you have questions, make sure you put them in the Q&A function so we see them once we get there. And I'm just going to go ahead and kick us off. So as we go into this, when we think about addressing childcare, obviously we need to ensure we're addressing the challenge comprehensively, including lowering parents' costs, supporting the childcare workforce, ensuring there is a sufficient supply of really high quality programs. So keeping that in mind, let's just start with how your states have supported your child care services programs or other child care strategies, either by investing state money into serving more families or increasing reimbursements for programs who participate. As I mentioned, Texas has leveraged our federal dollars very effectively, but we have not yet committed state funding to accomplish these goals. So I'm going to start with you, Michaela. Florida is a state that Texas always keeps a close eye on. And we certainly have noted the significant state funds that Florida lawmakers provided for your child care services program again, which is known as school readiness in 23 and 24. So can you just share with us a little bit more about what these investments were intending to accomplish and what they are accomplishing now?
Sure. So, yeah, thanks for the question, David. Thanks for having me all with you this afternoon. I know we're going to get into a little bit more about like why behind the Florida Chamber Foundation, why we take an active role talking about early learning, a little bit more detail later. So, I won't give you all of that now, but I did just want to give some context for sort of like why I exist in my job, early learning and literacy. We do view business as sort of a part of that three-leg stool as we approach sort of a comprehensive solution to early care and education. We believe that it's going to take all of us. So, our CEO, Mark Wilson, will often say that if you can fix early learning, you can fix 1,000 other things. And so we fundamentally believe that. As David shared, we do view early learning not only through the lens of brain science and how access to the quality early education programs compound into the results we want to see from that educational attainment, the workforce development perspective, but also for supporting like our current workforce, employees of businesses, our government, within our communities. So to begin to answer your question, we are proud and thankful of some of the recent investments we've seen into our early care and education system, led by some of our friends in the legislature and our governor. But it really didn't actually start with money. We first had to set up that quality system. So going back to that, so back in 2014, our state really began working hard on a pilot program towards improving our quality across the whole system. And we were building the capacity of our providers to implement those improvements. So we knew in a state as big as Florida that we had to take a decentralized approach. We have early learning coalitions here in Florida, which I think are your Texas maybe workforce boards, very similar. So we couldn't script our quality rating improvement system. We really went to them and tried to find common denominators that they could all agree upon, that we could sort of provide the base level of quality care. And we came up with class assessments, a really specific teacher professional development, and then some formative assessments, which today they now use Teaching Strategies Gold or TS Gold, as you might refer to it. So we could build off of all of that, and then our early learning coalitions could incentivize even further to meet their local needs. So we launched this pilot. We spent 5 years tweaking it, monitoring it, improving it. And then we could obviously measure the child outcome data at the back end to demonstrate how quality made a difference. We then worked all of that into legislation and into our state subsidy program, which is school readiness, as you mentioned, and as well as our state constitution's pre-kindergarten program, which we call voluntary pre-kindergarten program. So it actually went into both of the programs that our state does support. And that included an incentive structure for those programs that were meeting that basic, quality level that we want every child in our state to have. So right after, we then start working on our recalibration of our school readiness funding formulas to account for Florida's population change because that was sort of happening at the same time, and we knew we had to address that. So you mentioned the 2023 investment, you mentioned the 100 million, and that was really allocated to support the new funding formula, as well as another 77 million, which was allocated as a set aside, essentially to hold harmless any early learning coalitions and communities if we had estimated the funding formula wrong. So that's really where that money went to sort of expand and sustain services for our kids
Hmm.
still in our lowest resource communities, and who, we consider to be, oh, can you guys hear me?
You're breaking up a little bit, but you're back now.
Okay, so I'll start. So even moving forward after that 177 million, we realized that we still did not have enough in the base reimbursement rates to support children in our lowest resource communities and who we consider to be sort of like our greatest return on investment. So we began to sort of think about how even more so could we provide families the buying power they needed, so they could access those quality programs. And that's really where the $200 million came in. So we used the federal calculator to recalculate what it truly cost to provide that basic level of quality standards that we had sort of set up for those several years leading up to that point. And with 47 million, we increased reimbursement rates, again, and then we addressed our school readiness wait list with another 20 million. So that's really what we did. That was the intention of the program. Essentially, bottom line, give families the buying power, especially the families in our communities who maybe can't afford to access the best quality. And if they don't have access to that childcare, if they don't have access to that quality, they may quit their job. And so we definitely didn't want to see that. So that's what we were doing and what our hopes were for the money, and proud that that's what the money is doing today.
Yeah, that's amazing. I'm realizing that I could give you each a webinar and I have 35 follow-up questions, but moving on here, I another state, you all took such a comprehensive approach. I know North Dakota, you have done the same. Jessica, in our policy brief, as I mentioned, we spotlighted how North Dakota provided state funding to increase the number of scholarships you offered. I also understand that you all provided funds to really focus on infants and toddlers, which is a real priority in Texas as well. There's just not enough care for parents who have infants and toddlers. So can you just tell us a little bit more about these strategies and how lawmakers in North Dakota just settled on prioritizing these approaches?
Yeah, I sure can. And I have a feeling you're going to hear some repeated themes from all of us today and the way we've talked about it with our policymakers over these last couple of years, which I will say in our state, this is a new conversation. We have not historically put state dollars into childcare in this way, but we really, I think, came to a consensus understanding that childcare is a workforce issue. And when quality, affordable childcare is more available, it's easier for parents to work. And it really is just a very practical consideration for our policymakers. And we know all of the good things that happen for kids and families. But honestly, I think our coalition came together because childcare is a barrier to work. And in our state, we have more open jobs and we often have people looking for them. And so, really attacking workforce in very pragmatic ways caused us to think about childcare holistically. So we always say, you've got to do all three things at once. You've got to have affordability, availability, and quality. Any one of them alone is not enough. Two alone are not enough. So we put together a package with our elected officials' support and championship of it to tackle all three of those things. And the majority of the dollars in this, I'll say this last package, which was in our 23 legislative session, we're just preparing to go into session now in January. uh, about 75% of those dollars went to childcare assistance, what you call scholarships. So, really helping working families offset the costs of care. And some of it went directly to the base childcare assistance program, which I know all of our states have. It was seeded with federal dollars, and North Dakota, like many of you, we didn't put a lot of state money into it beyond what we were required to do for MOE. And this investment actually represented four times anything we'd ever put in before. And so, significant investment. And we did some things to boost infant toddler, and that was pretty intentional. So we wanted this to be implemented quickly. So we said, okay, we're going to build on infrastructure we have, which is the child care assistance program. Then we said every infant and toddler spot in childcare assistance will receive a 30% payment boost just on top of what we already have. So you already had your state max rate. Now you also get another 30% payment as a provider. The family doesn't have to cover that because it's a boosted payment. So the family's copays can maintain where they are and you have more families having access. But what we've seen is actually what we were hoping we'd see, which in the last year and a half, we've seen a 30% increase in the number of infant and toddler spots that are in our child care assistance program, whereas the overall program grew by 20%. So we saw a greater increase in infant toddler than we did overall, which is what we were hoping to see, which is a little bit of a both and scenario. And again, it's the absolute hardest care to provide. And when we really dial in on where our shortages are, it's in infant and toddler care. And so how can we both support families and providers at the same time? So this package tried to take a few approaches to do that. We layered in some additional payments if you're a quality rated program, which in our state is voluntary. So if you're on the quality path, if you have higher ratings in our state quality improvement system, you get boosted payments again through childcare assistance. We piloted an employer match program. So if an employer offers a childcare benefit, the state will match what they put in. So if the employer gives their employee $300 towards childcare and they are over the income limit for CCAP, the state will match it by $300. So trying again to push that limit above where we have our historic investment in working families, acknowledging that at least in our state, all the way up to 150% of your state median, affordability is going to be a concern, especially if you have more than one child under five. If you have two little kids under five, let alone three, affordability is going to be rough. Really all the way up to that 150% of state median. And so our elected officials were willing to do some experimenting and say, okay, this is really about workforce. We need to make sure that childcare is not a barrier. The balance of our package went to the provider community to try to help with training incentives for staff, with a variety of different facility grants, along with a number of other infrastructure elements that we hope makes their work more sustainable and easier. But again, I think, like you said, Michaela, and you said in the beginning, David, it's really only the beginning of what it's going to take to truly stabilize a sector that's under duress and has a pretty difficult economic model. So we're excited about the progress that we've been able to make and know hopefully it's just going to point the way towards what has to happen next.
Yeah, this is amazing. I mean, I set this conversation up by talking about the comprehensive approach it's going to take. And I mean, that's exactly what you described between all the different layers of support there. Just one quick, like, clarifying question. You mentioned the way that the employer match works is, there's the families that are eligible for childcare assistance, and then for those who are not, you have this other option. Do you guys have a wait list for your childcare assistance program?
We actually don't. We're fortunate enough that in our state we don't. We sometimes have the opposite problem where when we map who uses childcare assistance across North Dakota, there are parts of the state where it is barely used at all. And some of our most rural communities, our most frontier communities, has pretty heavy underutilization, I would say. And so one of our big goals with this was not only to see overall increases in utilization, but more equitable utilization across the state. So trying to lean in and make sure that no matter where you live, if you are eligible for childcare assistance as a working family, that we want you to know that it's available to you. So right now we operate without wait lists, which we know is a luxury that not every state has.
Yeah, in some ways it's a blessing and a curse, right? Because we want families to know how to enroll, how to participate, but we have to ensure that there are scholarships available for them. All right, moving to you, Faye. I'm very eager to hear from you because Alabama's taken a really, I mean, Alabama's been a leader on early learning in a number of ways, from your public pre-K program to the recent investments you've made into childcare. So, focusing on that, I know that you've provided these state funded incentives for childcare providers who participate in your quality rating and improvement program, what you all call Alabama Quality Stars in Texas. For our Texans on the line, that's their version of Texas Rising Star. Uh, so, Faye, can you tell us a little bit more about these incentives and how they support families and programs who participate in those programs?
Okay. Thanks again, David, for inviting us to share what Alabama's doing. But our DHR quality rating and improvement system, we call it the 5-star system. We've had ours in place since 2016, and it's designed, or was designed, of course, to help providers improve their day-to-day operations, with learning and environment for children, and also giving parents better choices for quality services for their children. So for several years, we had less than 100 providers that were participating in the program. So what we did when we received the federal dollars is that we made some major changes. We increased substantially the amount that we were providing to our QRIS providers, the bonuses, the incentives. And just as an example, I just want to share with you all, say prior to 2021, a star rated program was only receiving like $800 if you provided care for children within the range of 50 or less children. You only received $800 a year. Well, when we received the federal dollars, we increased that amount that a Star One center with 50 or less children could receive $9,000 a year. And then with family home providers, we boosted that amount from $200 to $2,200. And then for group homes, from $300 to $3,300. And as a result, when we changed some of the criteria, whereas a provider that was licensed within our state and met the standards for health and safety, that they could opt in to participate in our QRIS program because it's not mandatory. But if they choose to participate, they are automatically a Star One rated program, which enables them to receive those particular incentives on an annual basis. And just to give you an example of a Star One, I gave you an example of a Star One, but say a Star Five program that has at least 50 children, they can receive over $45,000 a year. So this is how we took many of the federal dollars that we were able to utilize to really improve our quality rating and improvement system. And as a result, right now, we have over 90% of our providers that are participating in QRIS and are able to take advantage of the benefits of the funding that we receive. And we collaborated with one of our state partners to assist us in this process because we knew that as a state agency, we could not do all of this alone. So we entered into a partnership with the Department of Early Childhood Ed, who also administers our pre-K program in the state, to assist us in that particular area. So, and we also expanded the subsidy eligibility for families so that more families could participate in our subsidy program. I think you call it some other name other than subsidy, but it's about, helping low income families gain access to quality rated programs. And we don't have any children on our waiting list. We are fortunate that anyone or any family who is interested in receiving the subsidy benefits to assist them with childcare, that we don't have anyone that's waiting for that financial assistance. So that's how we made some really major changes in our QRIS program, and it has, as a result, we have again enabled more and more providers to participate in QRIS in Alabama.
That's great. And I just, taking a step back again for our Texans, I do want to differentiate. You'll hear a lot about reimbursement rates for childcare programs, which are, of course, about when we essentially pay for a slot for a child who is receiving a subsidy or scholarship, whichever you'd prefer. What Faye is talking about is much more like what we did with our federal relief dollars, where we provided base grants to programs to really meet
Right.
the costs that allowed them to retain their staff or to provide pay increases to their staff to not bring down costs on parents to actually meet those higher levels of quality. Reimbursement rates are not the pathway towards that problem being solved. And I think what Alabama's doing is really innovative. So, Faye, thank you for breaking that down for us. So let's talk a little bit more. You all have touched on it, but a little bit more about just the campaigns, the efforts to actually take things from idea to law. Michaela, of course, you touched on that you represent the business community, right? And in Texas, the business community is mobilizing more than ever behind childcare, and there's a great appetite for business involvement in childcare. And it's striking when you talk about the package of things that you've done that the business community in Florida really seems to have rallied behind these public investments that are not just necessarily things going to the businesses themselves, right? It's not just tax credits or an incentive, but these kind of broader public investments into quality and to providing additional subsidies or scholarships. So how were you all a part of this effort from identifying the problem to making to ultimately getting it passed and supporting its implementation? And how does the business community see these efforts as helping the economic interests of Florida?
Yeah, great question. So really for us at the Florida Chamber Foundation, this is going to go back to what we call our Florida 2030 blueprint. It's essentially the goals that we've laid out as a state. There's 39 of them across 6 pillars. Talent and education is one of the 6 pillars that are really going to get Florida's economy to grow to be a top 10 global economy in the world by that year. And really, truly, when I say that, Mark Wilson says that all the time. He says, our CEO says that all the time. We know that nothing will be more important to driving Florida's future and our economy than a skilled workforce. And I alluded to it earlier, but when we really think about early learning, early care and education, we think about that as really as a two-generation workforce issue. So you're supporting workforce of today, they can keep their jobs. Like North Dakota, we also have less people looking for work than there are available jobs. We have like 94 folks looking for work for every 100 open jobs. So we really need to do everything we can do to get folks in the workforce who want to be there and we can keep them. And we've really been talking about how important this analysis for quite a long time. And then 11 months ago, we came out with a report called Untapped Potential. And Untapped Potential was really the first time that, in addition to the brain science and how important all of this is for the education and the foundation of our children, we really were making the economic case and the business case. And that report found that we as a state in Florida were losing $5.4 billion a year in economic value. And that came by way of absenteeism rates of employees, turnover cost, unrealized tax revenue. And so that's like a big sticker shock thing, right? Like billion with a B. And and in that, within the 6 months leading up to putting out that report, that 150,000 Floridians had left their job because of childcare. 50% of that 150 said, we're not coming back for another year or more. Like we're not coming back. We can't afford it. And so when we think about those open jobs, people looking for work, like that 150,000 people that left would have made a huge difference in our economy. And so when you ask the question about sort of the awareness and does the business community understand the importance of this, I think for not the first time, but in a new way, it was deeply motivating and very real for them that this was a huge issue that they needed to take up. So yes. What else? So I think something else that our business community really rallied behind as it relates to this issue, and something that I didn't mention in the first question, but our state subsidy program sort of had a benefits cliff, like it ended. And so we created a new program. The Speaker of our House, Speaker Renner, they came up with School Readiness Plus, and that was something the business community also supported. So essentially, what it did is it extended the runway from 85% of state median income to 100% state median income so that working families could continue to and keep their children enrolled in childcare and then gradually get down off that support instead of maybe having to make that really hard choice about what they were going to do when they were offered that raise. And we actually heard, stories about people turning down raises because, they would lose that benefit. So yes, we definitely see the business community very much so engaged in this. And they actively, sort of are investing in our work and our research, and are huge partners with us across the state so that we can continue to advocate, for these really critical needed investments, in this space to support our economy and our workforce, as well as our kids. So yeah.
Yeah, no, that's great. I mean, I think when I talked to some of the other Florida advocates, they really emphasized a lot of those messages, and they emphasized, frankly, how the business, community really was upfront and the face of a lot of these efforts around public investment and how vital that was. Jessica, you touched on the business role in some of your first response. And of course, the business community is such a vital stakeholder in this. In Texas, our scholarship program, even with that wait list, enables people within over 30,000 Texas employers who have somebody working today because they have access to a scholarship. So we know that the business community has a lot at stake here. And sometimes I will say that lawmakers sometimes get that important takeaway that the business community is a vital stakeholder and they need to be at the table. And then sometimes you hear a message that's a little bit like businesses need to go and solve the problem, which is a very different takeaway.
Yeah.
And so I'm curious sort of in North Dakota how you all have approached this because you had very specific strategies, kind of incentivizing businesses and also broader strategies. So can you just tell us about like how lawmakers grappled with those questions, how these investments kind of took hold in North Dakota, where again, like I mentioned this in your first, it's such a comprehensive package that tackled so many aspects of this. Like, how did they start to embrace that and see kind of the business role in all of this?
Yeah, it's like you were in our hearing rooms along with me. That was a conversation we had a lot, which was whose responsibility is it? And we talked a lot over the period of time that we put this together with policymakers, with community leaders, with economic developers to say there's not actually any one group that can solve this alone. And we really did just try to break it down in pretty straightforward arithmetic to say that, this families can't solve it alone. Childcare businesses can't solve it. Employers can't solve it. Communities can't, and neither can the state. Like everybody is going to have to take a role in this because it is, in fact, a perfect example of a broken market. And all of our goal is to help get as much stability into that market as we can so then we can get ourselves out of the way. But in the meantime, it's going to take everybody. And I think we really just tried to keep it very pragmatic. And we talked about a couple of things that I think helped that message stick, at least in our state. So I have to think that just about every one of our chambers of commerce across the state, including our statewide chamber, have childcare as one of their key priorities. And that came from, and it's similarly with our economic development group, with our rural economic developer groups, with our Main Street groups, it didn't matter. They would almost all say the same three things. Their top issues were childcare, housing, and workforce. The order might change, but the content was pretty much the same. And so, no matter where our elected officials came from in the state, they were hearing some version of this that this is different. We have to think about those very practical decisions that I often say, as somebody who's in the human service, field, why are you talking about workforce? Workforce is workers, and workers are people, and people have lives, and lives can be complicated. And the more complicated your life is, the harder it is to be fully engaged as an employee at work. And so, as soon as you like go down that path, literally everybody around the table is like, yeah, that's right. Like if you have caregiving responsibilities, that runs the risk of interfering with your ability to engage as an employee. And then the very next thing we would talk about to, I think, get this idea to take hold and be really organic and not something that you just have to be persuaded of, but you sort of know it, is we would look at the wage structure across our communities at jobs, and we call them Main Street jobs. And we would take our statewide wage data and just break it down by the average earnings for different jobs. And which of these columns of wages are you in if you are working at the local grocery store, and if you're working at the local bank, and if you're a carpenter, and if you are, in maintenance, and if you are doing direct care work, and if you're an architect, and if you are a dental hygienist, and we would just break it down. And we would say, the reality is that not every job pays the same, but our communities need every job. Every job is important. Every job matters. And employees across all of these occupations have families, and childcare is expensive. And so if we need people to be able to lean into work, we need to help them just solve that arithmetic for those period of time when their kids are young. And I will tell you, at least in our state at that time, and I hope it continues, and I have every reason to think that it will, is when you bring it down to that level of everybody's community, it doesn't matter how big it is or how small it is, you know that your community needs all of those jobs. It needs all of those occupations, and not all of them pay a high wage. And we want our kids to do well, and we want families to thrive. And sometimes there's math that gets in the way. And so if we can be prudent in how we think about childcare, we make that investment. Now, I know in our state, and it's probably true in yours, we don't want to make the investment any longer than we have to. I mean, the interest isn't that everybody has childcare and the government always pays for it. That's not our, that's not going to be our MO, but we are acknowledging that it's just a really practical workforce consideration for families right now. And what do we need to do to help get over that bridge? So that's how we approach it. It's how we talked about it. Just tried to have it be very much sort of a Main Street conversation about what does your community need to do well and be well, and what are the barriers, and can we help remove them?
Yeah, that's really great. I've actually decided that I'm taking the three of you with me to the Capitol, and we're just going to go door to door together, and we'll make it happen. So Faye, same question to you. You know, lawmakers in Alabama, as I mentioned, have taken a comprehensive approach to this. Like, how did that happen? How is that happening? Like, what is it that's driving the progress that you've seen in your time here?
Well, David, I could almost just echo what Michaela and Jessica has stated. It's an effort that involves so many partners. You just gotta be able to put the facts out there before our legislators to help educate them on the impact to their constituents, their community. And we're hearing the same message, from the businesses. Childcare is one of the barriers to workforce. They can't get people to come to work, and childcare is a topic that is coming up in every community, every business, every workforce meeting that I have ever attended and that many of us attend. Childcare is a topic that many of them want to address. And our legislators were committed to improve the quality of childcare. And I think that's through, the collaboration of work that was done through our commissioner, Nancy Buckner. We had advocates that came to the table and had those conversations with their local representatives as well as at the state office. businesses that in Chamber of Commerce that was voicing that same message over and over again, providers that were coming to the table, expressing, the dilemmas that they were having, and making sure that they had a business in place that could support the workforce, educating them on the fact that, childcare is not babysitting. It is a business, and you want quality care for your child and every child that's in your particular area. So it's a message that all of us had to really emphasize to the legislators and make it as personal as you can to their particular community. Businesses were identifying this as a major barrier, and every state, I'm sure, was working on trying to improve the work capacity within their state. So, this was a topic that they were really open to hearing about. And then we were there to share what accomplishments we were able to achieve, as a result of the federal dollars that were available to us. In Alabama, for example, when the pandemic hit in 2020, we only had about 12% of our child care providers that were open and operating. As we utilize these federal dollars to the best of our ability with grants and various means of supporting the child care industry. We had now have probably the majority of our center providers that were closed during that time that have now reopened. And we put in place with the grants that we provided to them that they were committed that once they received those grants, they would remain open for at least a year. So that gave us a little bit of cushioning there to work with our legislators to show that, hey, we've got these federal dollars here that's going to keep these child care facilities open and operating, quality providers, that we will need state dollars to help to support and sustain this industry if you're going to be able to get people into the workforce. And then in addition, our businesses, they had to step up. They had to have a voice, as far as their willingness to invest in, on-site childcare, also, paying for stipends, for their employees to receive childcare benefits. We had our Alabama Community College system that came on board, the Women's Foundation of Alabama. We had the chamber, various ones that were willing to step up, show what they could do in providing programs where we would have accelerated opportunities for these employees that we need in childcare centers and childcare homes to keep them open and operating. As my colleagues on this panel has shared, some of the issue is that the centers or homes may be open, but they may have empty classrooms, but they need staff in order to be able to open those classrooms up so that they can provide care for children. So we had some partners in Alabama to really work with us, to try to help again accelerate the learning opportunities for employees to enter into the childcare industry. And then in May, our legislators during their last session, we for the first time they researched, and of course they passed a child care tax credit for businesses, like $15 million for child care stipends, on-site care, or for them to reserve slots, for licensed quality facilities. They also expanded it to invest $25,000 in tax credits to providers who participated in our Quality Rating and Improvement Center, and also provided additional millions of dollars for grants that we can also give, to providers. Uh, Again, it's new, it's different, but we're seeing a path forward where our Alabama legislators are listening, and hopefully they will continue this level of investment because it's only a start. There's a lot of work to do in order to keep these childcare operations functioning like they should, and that children are receiving the quality care that we all expect, for children that we love and care for.
Yeah, absolutely. I was telling someone the other day that, childcare eventually needs to get to a place where there's not the childcare session, but like every legislative session, I know for sure that Texas lawmakers are going to be talking about transportation. They're going to be talking about public
Right.
education. They're going to be talking about teacher pensions. And childcare just needs to be in that place where every session it's what is the legislature going to do. So for folks who haven't submitted questions, start to get those in. We'll try to get to as many as we can. If there's anything you heard that you want a little clarity on or a little bit more of the story behind, please put those in the chat. So, excuse me, in the Q&A. So last question from me. So our legislative session begins in January. Advocates and providers and everyone are getting ready for the advocacy ahead. What is one piece of advice that maybe you haven't shared yet that you would share with us who are, I'm sure, just uh, busting out of our chairs trying to accomplish much of what you all have accomplished? What is one piece of advice you would share, whichever one of you would like to go first?
Well,
I
I
could
would like
start.
to,
Oh,
okay,
go ahead, Jay. You can go.
okay. Uh, I would like to say that I think it's important that all of the partners come to the table with a unified voice on the issue prior to even meeting with your legislators. Because if you have different groups that's coming with a different demand or different desire for them to act on, it only confuses them. So if it's possible for all of those that have a interest in whatever it is that you want to achieve, that you come together with a unified voice to share that message with your legislators.
I would just add if there's a way to, I know and you started, David, by saying, we talk about this as a childcare crisis, but to also make sure that policymakers know progress is possible. Like progress is possible. We can do things that matter for employers and for communities and for families and for childcare businesses. We can do things that matter if it's a unified approach, like you said, Faye, if we're thoughtful about how we partner, if everybody sort of takes their part of this puzzle and moves forward in the same direction, it is not such an intractable problem
Mhm.
that we won't make progress because we will. And I think for us, that was important to move it from the realm of one of those things that there's just, nothing you can do about to something where change is possible. So I'll throw that out as maybe my one addition to what Faye said.
Yeah, and I love what you both said because you basically both of those things were on my list of advice. We have the Business Alliance for Early Learning Project, which is essentially where we are bringing all those cross-sector partners together. We're leading from the business community. We have philanthropy, we've got community, we've got childcare advocates, and we're meeting weekly, some of us, to make sure that that message is unified. We don't want one of us going in and asking for, a pocket of money to do reimbursement rates while somebody else is coming over here and starting to talk about, teacher pay. Like we don't want our messages to compete with one another where it honestly frustrates folks because we can't even figure out what we want to improve our system. So I think that is really important. So, if there's not a statewide council or sort of advisory group, getting folks together like that, I'd say that's probably a good first step. And this work takes time. Like in my first question, I was answering it by talking way back about like 2014 and 5 years and a pilot and this tweaking and all these things, right? Like a historical context. But, I think being strategic about sort of those bites we're taking out of the elephant and starting with quality and thinking about expanding access and affordability and realizing that it doesn't just happen, right? Like in Florida, we also have a child care tax credit, but that is like one small part of the overall comprehensive way that we approached this work and this system. And it's taken us a long time to get there. So we have a lot of pieces and a lot more work to do, but it is possible. And I think we sort of have like that moral imperative because there's lots of children who need that quality care. And if we can just change, the trajectory for one child and, their future generation's life, I think that's a great thing.
Yeah, I agree.
Yeah, great advice, y'all. All right, I'm going to try to get through a few of these questions. I think some of them can be answered quicker than others, but one question was around health benefits for educators employed by providers. It's a huge barrier affecting the workforce. Have any of your states grappled with this of just health insurance for educators, or have any lessons learned around trying to explore that?
It's one of the areas we haven't made progress on. I'll just say that it's come up a lot for us to try to problem solve, and so far we haven't been able to crack that nut. But we also are looking around for ideas of what are the new ways that we can approach this so benefits are reality for people.
The same for Alabama. We have not directly tried to address it. What we did do with the grants that the providers received, they had that flexibility, to provide, benefits to their employees. So it was really up to the providers to decide how they wanted to use that grant money that we were awarding to them. And QRIS dollars that they are receiving now also opens up that opportunity for them to have that flexibility to invest. So we try to educate them on those opportunities.
Michaela, anything you would add?
No, I would just say that I don't really have anything to add about what we've tried to do, but I can ask folks who will be closer to that issue and follow up.
To Faye's point, I think a lot of this comes down to whether programs have the financial stability to meet these various needs, right? Like we can tackle them directly, or we can kind of get at the root problem, which is just that math problem I expressed earlier. Another question here is, what are some of the barriers and or lessons learned that you've encountered when integrating funding and access with quality improvement into state policy? So just like the various, the governance of all this issue is very complicated. The funding streams are complicated. Are there any lessons that you all would share about just that kind of technical issues?
I can start for us. We in 2021 consolidated a lot of our early childhood work into one area within Health and Human Services. Prior to that, it was in multiple agencies. And so that's allowed us to um, take really concerted efforts, maybe a little bit easier than it would have been otherwise, to try to address some of those challenges of lining up different funding sources, different, who is in charge of quality, how are you going to get that to this system so you know in time to make this payment to this person. And so that was one of the things we did, is just try to have organizational coherence so we could act as one a little easier. Um, Not the total answer, but it's helped us make progress a little bit faster in our state.
I will say in Texas, we have our subsidy scholarship program and our workforce commission, our childcare licensings and our health and human services commission, our pre-K is in our education agency. And
Yeah.
there's different House and Senate committees that oversee all these things. So
Mhm.
we know the siloing well. Michaela, Faye, anything either of you would add?
Well, we haven't been faced with any issues in Alabama because our agency, DHR, oversees the subsidy program, licensing program, and all of that. So we're pretty much, on board with utilizing and distributing the dollars as we receive them. So we haven't had that issue to
So
try to
we
address.
Yeah, we definitely we do have some silos, but I would say we have the Division of Early Learning now that lives up underneath the Department of Education in Florida, which is rather new for us. And they are contracting with the Early Learning Coalitions to deliver our state subsidy program as well as the pre-kindergarten program that I mentioned earlier. So really, it's the strength I think of our early learning coalitions to deliver those
Mhm.
programs and sort of navigate among the different silos. So. I think a big part of the sort of lessons learned, I think that decentralized approach and kind of getting people on the front end aligned around what we were going to do with that quality improvement system was really important. That they had a say in that, and that there was that base at the state level that was being set with the QRIS, but then the early learning coalitions could meet local need and build upon that and maybe incentivize in addition to it. Does that make sense?
Absolutely. Faye, there were a couple of questions about the grant, so I'll just combine them here. They're around just how those programs are funded. That is with state funding, correct? There was a question of whether it was state or federal funding or both supporting those grants, and how have you ensured that you're keeping those increases sustainable?
Okay, the QRIS grants were funded as a result of the ARPA dollars, the federal dollars that we received. That's how we built that program and increased those particular amounts for providers who were participating in our quality rating and improvement system. Our message to the legislators were, we have increased this amount. This is the level of participation that we are receiving from providers. And that's when they invested the state dollars for our QRIS program. We did separate grants with the ARPA dollars, stability grants and things of that nature with the ARPA dollars, and that's a different source of funding, but they were federal dollars. So the state dollars that were awarded that you mentioned earlier, those are the dollars that the legislators invested for us to continue to support our QRIS program, our Quality Rating and Improvement System program. The other grants that we awarded, the stability grant, workforce stability grants, were grants that will go away as of the end, that we dispersed the last of those funds the end of September. Those providers who received those grants, those federal dollars, committed to remain open and operating for at least a year. So that those are two different funding sources that we're discussing here. And hopefully that helped to clarify the question that came forward.
Yeah, that's great, Faye. Well, thank you all so much. This has been uh, really inspiring for me and motivating, and I think probably for all of our panel or our guests as well. I'm going to share one final slide here, which is recently a letter was sent to lawmakers by over 120 Texas groups. We are excited to be one of them, around a package of well-vetted childcare proposals. And we know that this is a sampling of the proposals that lawmakers are probably going to hear about this session. Childcare is a big issue with a lot of voices supporting change. And this package was supported by chambers of commerce and hospitals and other medical associations and faith-based groups and advocates and providers who have supported a package of things, including strengthening that child care services program to serve at least 10,000 more Texas parents, as well as addressing some challenges within our reimbursement rates that are penalizing programs in lower income communities, especially. Really building up the supply of childcare programs and supporting slots that meet specific urgent needs like after-hour care and nighttime care, infant toddler care, care for children with disabilities. And I'll clarify too that that doesn't really mean building new buildings, right? As I mentioned, the classroom space is there, but we need to ensure that there's targeted funding and other strategies that enable us to support these important needs. Ensuring that programs can recruit and retain qualified and effective staff, including by ensuring that educators can access supportive care for their own children. In that policy brief I mentioned, there are red states, blue states, and purple states who have taken strategies to ensure that child care program educators can access scholarships for their own children. And that's something that we need to prioritize this session as well as figuring out ways to support effective, high-quality pre-K partnerships where schools and childcare programs can work together to provide high-quality early learning. So over 120 Texas groups supported this package. We know there will be other ideas this session as well to support childcare. So I'm looking forward to a great legislative session on this. Thank you again to our amazing panel. If you're still on the line here, you can always email me here, but I really appreciate everyone's time. Thank you so much.
Thank you, David.
Thanks, David.